Um, this video will have a little bit less um, visual than some of our usual Zoom calls, just for safety precautions. Topics like this around anti-racism, especially right now, and speakers like Tim Wise are often threatened by folks who are racist and actively attacking and targeting people who advocate for anti-racism. So at some point you might see your video muted, but that's part of our process to try to keep this space as safe as possible. Just want to introduce myself. My name is Martin Vitorino. I'm the Deputy Executive Director at Insight LA. And I'm so grateful to have Tim here. He's back in just a few months. He's, as you all may know, a very prominent anti-racist educator and author in the US, and is known for really incredible books like Dear White America, White Like Me. He's a prolific writer and speaker, and we're really, really honored to have you back. We learned so much from you last time and got so much great feedback, and people are still having lingering conversations around the incredible topics that you brought up. You're also really just a dynamic speaker and really enjoyable to listen to. So we're really excited to have you, and I'm so grateful that you're taking the time to do this.
Oh, you bet. Thank you.
Yeah.
Well, I can get rolling if you, or do you have something else I didn't know?
Well, just one more thing in terms of process. So you'll be giving your talk, and then there'll be opportunity for question and answer at the end. And what will happen is you can send a message to one of the hosts, which will be Donna. Donna, you want to say hello? Hey, Donna. Donna, thank you. Donna's one of our amazing volunteers who moderates a lot for us, and so appreciate your efforts as well. So if you have a question, you can type it into the box. It will go to me and Donna and I will read the question to Tim. Tim is not going to be moderating the chat box. So just so you know, when we're open for questions, we'll let you know, and you can go ahead and type in your questions there. And now I'll just turn it over to you. Oh, and also this is going to be recorded. So once again, if you don't want to be recorded at all, you should mute yourself as well. Okay. Thank you, Tim.
You bet. Thank you. Well, first off, let me start by saying first, I mean, thank you for having me back, obviously, even though it's not really back in the physical sense, but in this sort of virtual space that we've created here. This is the third or fourth one of these that I've had a chance to do since the beginning of, lockdown sort of stay-at-home processes a couple of months ago. And I'd like to think I'm getting better at these. I'd like to think that I'm better at the technology than when I started, but I make no promises. So my first disclaimer is if, and it could happen because it's happened in one or two of the other ones, if I lose connectivity, if my network goes down, just hang with me for a minute. I'll be right back. Same thing with any of you. We will hang with you, and you can get back whenever you can. I live in a home with 3 other folks, all of whom are using the internet, 2 high school students, who are on. So you just never know if we've got the bandwidth to really support this or not, but I guess we'll find out, and I'll do the best that I can. So just, bear with me because I'm not technologically the most savvy, but I can pull it off. I mean, for a 51-year-old guy, it's more complicated than Atari. So therefore I'm a little behind the times, but I'll do the best that I can. So thank you for having me back and to talk about race and racism and anti-racism as it relates to the pandemic and this moment that we are in, which is obviously a very frightening time, a very stressful time for everyone. I hope everyone on the call is doing all right, staying healthy, staying safe. Your families are healthy and safe. We're in Nashville, and we're doing the best that we can in a city that is taking it pretty seriously, but a state that I must say is not. And that's one of the things that happens when you're in one of the somewhat pseudo-progressive bubbles of a not so progressive larger place, as I think millions of people around the country are. So we're doing the best that we can under the circumstances. When it comes to talking about race and this particular topic, I know that there are some folks who have different reasons for it, but some folks who maybe don't think we ought to talk about race as it relates to COVID-19. maybe don't think that it's an important conversation. And I would say there's sort of, two groups of people who might say that, right? One would be the folks who never want to talk about race and racism, right? So folks whose politics and ideology are more reactionary and think we ought to just not talk about this at all. They would rather avoid it. That's a lot of folks, obviously, in the white community who really don't like to talk about race and racism on a good day, right? Let alone a day where we're all sort of sheltering in place and millions of us in a sort of lockdown mode, worried about becoming ill as a result of coronavirus. So that group, we're sort of used to hearing the colorblind argument from, that we ought to just not talk about it, that we should be colorblind, or as Mika Pollock calls it, color mute, right? Not talk about these things. Then there's another group. I think their motivations are different. They're maybe a little bit more liberal, a little bit more progressive, whatever that means, but they're worried, understandably, that we might, if we talk about race and the coronavirus, that it might encourage people, frankly, in the white community who don't talk about race very often, to sort of have a false sense of security and say, oh, well, it's not my problem, right? It's their problem. And so their motivation for not talking about race and the pandemic might be different. We might even say it's a well-intended motivation, like they're worried about the backlash from discussing race and the pandemic. And yet I want to suggest that even though there might be some truth in that, and in fact, I'm going to suggest in a minute, there is some truth to it, and we're seeing it right now. The fact is, if we don't talk about the racial and identity-based disparities that are prevalent in this particular moment, and some of the racial issues that are raised by COVID-19, not only are we going to be failing morally and ethically in our obligations towards one another, but I would suggest we're also going to be creating a very dangerous precedent that actually will ultimately pose a risk to everyone, not just to people of color. So it might be easier not to talk about race, might be easier to avoid it, just like it's always easier for some, I suppose, if we don't talk about it. But if we do that, we're going to end up, I think, increasing the risk to everyone and never really solving the problem. To be colorblind in this moment, just like any other time, is, as Julian Bond, great civil rights leader, once said, to be blind to color is to be blind to the consequences of color. And if color continues to have consequences, which it clearly does in this country, then we have to be prepared to address those. We can't get sidetracked by the nice sort of pretty claims that some people make, that, we're all in this together and coronavirus is the great equalizer. All of these things sound very nice, but of course they're not true. They're not an equalizer racially, economically, in terms of identity. Some folks are being hit, frankly, quite a bit harder than others. We might be in it together in the sense that we all want to find a solution, but we're not in it together in terms of where we sit on this side of the pandemic, trying to figure out the path through. And so, as nice as it might be to proclaim this unity, you can't paper over existing divisions with false unity. We did that after 9/11. A lot of folks tried, right? I remember the bumper stickers that people had on their cars that said, "United we stand." But, this was something that for people of color, for low-income folks of all colors, for LGBTQ folks, for anyone in a marginalized space, we weren't really united, except in this sort of, I guess, tangential kind of way, not at a deep level. And so we can't simply say that we have unity and avoid discussing the difficult pieces of this. If we're ever going to create a society that is one that's committed to public health for all of us, we're going to have to address race and racism, because, as I'm going to show you in a few minutes, race and racism and racial inequity are one of the reasons, one of the key reasons why we don't currently have a better public health system. So you can't get to that better public health system that we all need. You can't get to the kind of society that would be better and safer for everyone unless you address the things that are keeping you from getting there. And one of those things is precisely this subject of racism and racial disparity. So you have to go through it to get to where you want to be. First, I'm going to make this sort of go in stages. The first stage, I just want to talk about some of the obvious ways that race is implicated in this moment and in the struggle that millions of people are having as a result of this particular pandemic. And then I want to talk about some ways that maybe are not as obvious to everyone, that ways that race is implicated, ways that whiteness is implicated, ways that identity is implicated. And then, of course, once we've done that, we can talk a little bit about some of the ways that we can begin to build anti-racist practice and build anti-racist muscles in this moment to meet the crisis that we're facing. The obvious ways in which racism is implicated and race is implicated, I think we all know. It really began as soon as this crisis became a crisis with the racialization of the virus itself on the part of political leaders and certain commentators on the far right who really racialized coronavirus by looking specifically at not just China as a nation, but Chinese people and really more broadly, Asian folks in general, who were at the receiving end of a significant uptick in hate crime activity in the United States and probably elsewhere as well. But I'm familiar with the research and the data here in the U.S. A big uptick for a period of several weeks, for the first month to 6 weeks of the coronavirus being a major story. There was a substantial increase in both physical violence, verbal assault, people who were, openly talking about not wanting to go to Chinese restaurants or Japanese restaurants for fear of contracting the coronavirus. So that may not be a hate crime to not go eat at someone's restaurant, but if you're scapegoating an entire community for a virus, it's a very simple step from that to larger bias against Asian and Asian American communities. So we saw that certainly at the very outset, the president and others making comments referring to this as a Chinese virus, the Chinese flu, the Wuhan flu. And keep in mind, this isn't something that we've always done with other viruses. For instance, in 2009, when the H1N1 swine flu was prevalent and lots of people in the United States suffered from that. That flu, according to the CDC, they went back, they traced the genetics of it, and they found its origins actually in hog farms in North Carolina in the late 1990s, early 2000s, like a full decade before it became a major national and global problem. The virus had really begun there. Its origins were there. But we didn't call it the North Carolina hog farm flu. Nobody would have thought to call it the North Carolina hog farm flu. No one even called it the American flu, right? In other words, we don't always talk about the origin of these things, but we did in this particular instance. And I would suggest part of that is that goes with a longstanding tradition of scapegoating the other, right? Blaming the other. If you look at the history of disease and illness in this country, we have a long history of blaming immigrants for bringing disease, particularly immigrants who were either of color or perhaps from Europe, but of an ethnicity that marked them as not quite white yet. So we did that with Italians, we did that with the Irish, we did that with Jews. We've done that with certain subgroups, but always groups that were racialized as less than the sort of white norm, right? So it's nothing new. It's just keeping with a longstanding tradition like racism always is. It's really not anything we haven't seen before, but it's just worth pointing out. The second way in which race is obviously implicated in the COVID crisis is in terms of its disproportionate impact. So it isn't just the way in which we've responded by blaming certain communities. It's in terms of who has also been hit the most. We know, for instance, in state after state, a disproportionate number of the infections, a disproportionate number of hospitalizations, and a significantly disproportionate number of fatalities have occurred in African-American communities and Latinx communities in particular, as well as indigenous communities. And that data isn't even being kept very well at all. It's not being reported on very much, but you have a significant number of outbreaks in tribal nations and on reservation lands. You have a significant number of outbreaks in Latina communities, many of which not being reported on very much. You have a significant outbreak, of course, in certain job complexes and industries where there is a disproportionate number of people of color in that job. So the meat packing facilities in Wisconsin, in Iowa, in Nebraska, for instance, where there have been significant outbreaks, slaughterhouse and meat packing facilities, disproportionate number of the employees, the workers in those plants are Latino and Latina immigrants. These are some undocumented, many documented. And I don't think it's a coincidence that the president is so quick to want to keep those plants open. It's really not a lot of concern being shown about their lives, about their health. Probably a little different than would have been the case, let's say, 30 years ago when those same slaughterhouses and meatpacking plants were overwhelmingly staffed by white employees. I remember the first time I ever went to Iowa. It was probably in the mid 1980s, and I was a high school debater, went there for a debate tournament, and there was a slaughterhouse in Cedar Rapids. There were lots of them. That was like all that, you got there, and it was everywhere. And most of the employees in those days were white. I have a feeling, maybe it's speculative, but I don't think I'm probably too far off, that if the worker base in those places was the same today as it was 3 decades ago, we might be seeing a very different reaction, right? So certain people are being viewed as largely expendable, and they're the ones who are disproportionately feeling the impact. In places like New York, you have black and brown neighborhoods being the hardest hit. You have folks, obviously, in some of the most important jobs, which we maybe didn't realize were always the most important jobs, but we're learning that they are, right? Who are not just working class, which is the economic piece of this, but they're also disproportionately people of color. Whether we're talking about frontline nurses and folks who work in the hospitals other than just the physicians, whether we're talking about people who deliver the food to the grocery, get it from the grocery to us, whether we're talking about front office people in administrative jobs who were the ones trying to get folks unemployment checks or get them checks from the federal government, the people who disproportionately have these jobs who oftentimes are not seen as essential, people who work in elder care facilities, which are being hit so hard right now, who are clearly not seen as essential based on how we pay them. I think the median pay for people who work in elder care facilities is like $21,000 or $22,000 a year. And we are a culture that lets you know how much we value you by how much we pay people to take care of you. So we don't clearly value kindergarten teachers, child care workers, or elder care workers. And who are they? They're disproportionately women. They're disproportionately working class. They're disproportionately of color. And so all across the country, this is contributing to the disparity and impact because these are folks who can't take off. These are people who don't have the financial means to take off. They don't have the financial means to not go to work, and they're being required in many instances to continue working. And as a result of all that, there's obviously a disparate impact. The most recent data has found that majority African-American counties in the United States are having about 50% of the infections and 60% of the deaths. And those counties, individuals there are about 6 times more likely to die from COVID-19 than folks in majority white counties. So there's clearly something that is happening. Now, the question is why? And it's important to think this through because I think there are some answers that are often given that are not quite adequate, right? And these are not answers. I'm not talking about what reactionary people would say, because reactionary people might look at that and say, well, you know what they say? They say, well, those people, they don't take care of themselves. They don't eat right. They drink too much. They smoke. They do drugs. Okay, first of all, right, we know from the data that white Americans drink more heavily than Americans of color, use drugs equally to Americans of color, are just as likely, if not more likely, to smoke than most people of color. And we all in this country sort of eat like crap, frankly, right? None of us really eat as healthily as we should. We could all eat less processed food. We could all eat much better. We could all exercise more. That's not a racial issue. It's not an ethnic issue. It's not a cultural issue. It's an issue of the country as a whole. And so when you have these disparities, even in the same communities, even in the same city, it can't just be about cultural norms. It can't just be about eating habits. It has to be something else. The problem is not the reactionary argument that tries to blame the victim. The problem is sometimes even those of us who are maybe more progressive jump to a conclusion that isn't quite right either. And so one of the things you'll hear people say, more liberal and progressive and people on the left, would be, well, yes, there's disparity. That's because people of color are disproportionately lower income. That's because people of color disproportionately maybe, don't have employer provided health care or any health care. And that's the issue. They can't get care early. They're not able to take off work. If they had a better class status, socioeconomic status, things would be better. And so those people will then say, well, what we need, is universal guaranteed health care and paid leave, all of which is true, by the way. Certainly won't get an argument from me. But one of the things that sometimes progressive white folks miss in the conversation about healthcare is that the disparate health outcomes faced by people of color are not simply a function of economic status. It's a mistake that's very commonly made, right? So people will say, forget COVID for a minute. Just in a normal year, they'll say, well, the disparately bad health outcomes enjoyed or not enjoyed, as the case might be, by people of color are the result of economics, greater poverty, less income. Yeah, that's part of it. But here's the really disturbing fact that most people don't realize. Even when you look at Black folks in particular who have college educations, who have pretty good paying jobs, who have pretty good health care, who don't smoke, who don't drink, who go to prenatal care when the mom is pregnant, and they go to all the well baby visits, the visits you do while you're pregnant during the period of gestation. Even those women who do everything like that they're supposed to do, and they have pretty decent class status, socioeconomic status, those African-American women still have higher rates of infant mortality and low birth weight for their children than white women who dropped out of high school, don't have particularly good paying jobs, don't have comprehensive health care, don't go to a single doctor's visit during the period that they're pregnant, and who do smoke every day. So in other words, even white women who do everything quote unquote wrong and have worse socioeconomic status are having better outcomes for their children than Black women who quote unquote do everything right and have higher socioeconomic status. And low birth weight and infant mortality, that's considered a key leading indicator of population level health that one can look at to determine sort of what's going on. So how is that? How is it that Black women who are higher up in the class strata have worse outcomes, worse health outcomes for themselves and their offspring than white women who are lower in the class strata? Well, it can't just be about economics. It has to be about something else. Well, the research tells us what that something else is, right? It tells us that it's the result of Black and brown experiences with discriminatory treatment, the stress that comes from that, the weathering on the body that takes, the increase in blood pressure, the release of stress hormones, all of the things that we know are associated with hypertension, associated with heart disease, et cetera. So number one, there's a racialized aspect to healthcare, which is putting Black and brown folks in worse health to begin with. Then when you have something like COVID, they are going to be disproportionately affected. Universal healthcare won't solve that problem. You could have universal healthcare, but if someone is still experiencing racialized mistreatment, yeah, they're going to have insurance, they're going to have healthcare, they can get care, but they're still going to be sicker. They're still going to be having to go to the doctor and the hospital more often. So you haven't really solved the problem. You might be able to address the problem better with better, more comprehensive healthcare, but it's not going to solve the problem. And the second important piece is you have to ask yourself then, all right, well, why don't we have that kind of care already, right? Why don't we, for instance, have the kind of universal guaranteed health care that is so common in other Western industrialized nations? Because if that's the thing that certain people need, you still need to ask why it doesn't exist yet. And a lot of times in this country, we don't have that conversation. But the research on that is very clear too. Several studies have been done, and what they have found is that one of the most highly correlated reasons why, one of the most significant reasons why we do not have guaranteed health care and stronger social safety nets for people in need is because of a widespread belief on the part of white Americans that if we had those safety net programs, Black people in particular would quote unquote abuse the programs. And so as a result, we're less likely to support having the very kind of programs that we need, not just that Black and brown folks need, but that we need too. As a result of that, racial bias or racial resentment, racism itself against other people having certain things is keeping everyone from having the kind of comprehensive safety nets, public health safety nets that we all need. So this disparate impact that people of color are experiencing isn't just about economics, but to the extent it is about something like universal health care, the reason we don't have that and the reason that that is hurting them is because of racial bias that is keeping us from developing those kinds of broader safety nets, which then leaves us all at risk, right? Makes it hard for any of us to take off work, makes it hard for any of us to get the health care preventive health care that we need, makes it difficult for us because we're worried about being able to afford the bill if we go in and test positive for COVID. You know, now supposedly it's going to be covered, but who knows if that's true, right? The idea here being that we end up having weaker safety nets because of racial bias, and that ends up having a blowback effect on everyone. So we have the disparate impact. We don't have the safety nets necessary to deal with the disparate impact. All of that is the stuff that we've been talking about in the media. So that part, I think, is reasonably well known about the kind of impact that COVID is having. But I think there's some other aspects that we haven't discussed as readily. First is the reaction to the virus itself and how we have responded in this particular moment, as opposed to how we might have responded had the virus been having a different effect in a different direction without this racial disparity. Because this is really how you sort of get a sense of where we are as a culture and where we need to go. So I want you to ask yourself this question. If this virus were affecting disproportionately white, disproportionately middle class to affluent, disproportionately healthy, not people with pre-existing conditions, but healthy, and disproportionately people in their prime of life years, 20s, 30s, 40s, right? Do you think that we would have the same nonchalance about quote unquote reopening everything? Would we see thousands of people around the country going to their state capitol buildings and demanding the right to go back to work if the virus was hitting white folks, upper middle class folks, younger folks, and healthy folks the way it's hitting Black and brown folks, working class folks, older folks, and people who have pre-existing conditions? Now, I asked that question. It's hypothetical. It's also, I think, pretty obviously rhetorical. I think we know the answer to the question. If this virus was hitting the opposite demographics of what it's hitting right now, I don't think you would see nearly as many people demanding a reopening, and you certainly wouldn't see the people who were demanding that reopening. Because when you look at these demonstrations, whether it's on Huntington Beach, whether it's in the state of Michigan at the state capitol, wherever it is, right? It's not a very representative sample of America out demanding a reopening, which is interesting because the data says the people who are most likely to have lost their jobs are Black and brown. So if anybody would have a reason to go to the state capitol and say, I need my job back, please, you need to reopen because I'm hurting, I can't pay my bills, Black and brown folks are twice as likely to have lost their jobs right now, according to the Labor Department data. So they'd be the ones out there, and yet they're not, right? It's disproportionately white folks who need to apparently bring their guns because viruses are known to respond to heavy artillery. And they go to the state capitol, they demand a reopening, they say all jobs are essential. Okay, I'll buy that. I think that makes sense. But it's interesting to me that they're so cavalier. And so a lot of people, have sort of articulated, God, these people are just rolling the dice with their own lives. But are they? Because it seems to me that's not really accurate. They might be, but they don't think they are. They think it's not going to affect them. If you really thought that going to work was going to kill you, you probably wouldn't go to work. There are people who do jobs that are very dangerous, where their lives are at risk, but the vast majority of us, that's not our gig, right? The vast majority of us, people not going to the cubicle, wherever it is that they work, if they really thought the cubicle was going to kill them, right? Most people not going to go do your normal job if you really thought that it was going to kill you. Most people don't sign up for that, right? I fly in normal times every week. I don't understand aviation. I didn't pay attention in science class, so I don't know how it works. I'm not convinced it does. I think it might be witchcraft. But the point is, when I get in that plane, even though I knew it could go down, I really sort of figure it's not gonna. Like if I actually thought the plane was gonna go down, I wouldn't get on the plane. I'd find a different way to make money. I would have started doing Zoom calls 15 years ago. I would have created Zoom if I was really afraid that the plane was gonna go down, right? Most people would not gamble with their lives. These folks at these rallies are not gambling with their lives, but they are gambling with other people's lives. Whose lives? They are gambling with brown lives. They are gambling with Black lives. They are not playing with house money if they were a casino, right? They're playing with somebody else's money, right? They're borrowing that money and risking other people's health because deep down, they don't really think it's going to be them. It's one of the reasons that you've seen a number of reactionary congresspersons who have tweeted out, as if to say, what are we afraid of? They tweeted out some data from Italy. And the data from Italy, for instance, found that 99% of all the people who have died from coronavirus in Italy had some type of pre-existing health condition. Now, there are two things about this being tweeted out and being mentioned by these congresspersons. Number one, it's sort of a grotesque subtext to that, right? Which is, it's just the sickies, it's people who had diabetes and high blood pressure and asthma. So, but, I beg to remind you, diabetes, high blood pressure, asthma, these are not things that are death sentences. This is not people who were like last stage of cancer with one foot in the grave, going to die in 2 weeks, have been given an expiration date. I have asthma. I work all the time with asthma. People work all the time with diabetes. They work all the time with high blood pressure. These are normally manageable conditions. So the fact that 99% of people died, and that's supposedly a reason that 99% who died had a pre-existing, and that's supposedly a reason we shouldn't worry about it, is like saying, well, if you got one of those conditions that normally isn't a big deal and it might kill you this time, no big deal for us. We don't care, which is grim in and of itself. But what's also disturbing about that is that when you say these are people who are already sick, it's sort of like saying, I'm not worried about me. I'm good. And so when people have described some of these folks on the far right, and you've probably heard it said, as a death cult, right? They're Governor Abbott in Texas, Lieutenant Governor Dan Patrick, radio broadcaster Glenn Beck, and others who've said they'd be willing to die for the sake of the economy, get back to work so we can save the country for our grandkids. It sounds either selfless or suicidal. It ain't either one of those. It's not selfless because they're prepared to risk other people's lives, and it's not suicidal because they're prepared to risk other people's lives. It's homicidal, right? It's not Jim Jones at the People's Temple in Guyana, right, saying drink the Kool-Aid. It's Jim Jones followers being like going out into Guyana and getting the locals to drink the Kool-Aid, right? It's not suicide. It's not a suicide pact. It's like a professional murder hit that you're putting on other people at some level because you don't value them as much. And it may not be conscious, as I probably talked about, I think, when I was there before. A lot of our racial biases aren't conscious. A lot of our class biases aren't conscious. It's not like people sit and always deliberately think about these things. But if we would respond differently, if the people mostly being affected, disproportionately being affected, looked different than the ones who are, then that tells you something, doesn't it? By definition, about which lives we value and which lives we don't. I mean, it simply does. It basically says, yes, we know that reopening could cost tens of thousands, maybe 100,000 more lives, but half of those are going to be people of color. They're overwhelmingly going to be working class. They're mostly going to be people who were sick. And so we who are not in those categories can say, well, it sucks and it's awful, but it's not going to be us, without even realizing that the mentality that we've just sort of manifested, right, is the mentality that has been at the root of history's greatest crimes, right? This idea that there are certain people whose lives simply are not worth as much, that people don't have intrinsic human value, that their value is transactional, right? That their value is about how much they produce, about how much that they produce for the society in the mind of whoever's making the determination. Because I could make the argument that working class folks actually do more producing, that they actually contribute more. I could argue that someone who works in an elder care facility contributes a lot more than a Wall Street banker, right? But not by the standards of the culture, which say that we determine life value based on earnings. We determine it by how many taxes you pay. We determine it, by all of these sort of elite standards. So that's one of those ways in which we haven't really talked about race and class in terms of our reaction. And the nonchalance of many, I think, has to do directly with the way in which certain people are being disproportionately affected. Let me give you another example of how I think maybe race is implicated in ways that we haven't discussed. There's also at the root of the problem here, not just the thing I mentioned before, which is the lack of a universal healthcare program, which itself is tied to racial bias and racial anxiety about Black people and brown people abusing the program. But it's also the hyper individualism that marks our culture, right? So we live in a society where this notion of the rugged individual, sort of isolated from their society, separated from the whole, abstracted from the community, is like the dominant ideology. And it's an ideology that, of course, has never really worked very well for people of color, because people of color have understood that as they were not simply marginalized as individuals, they were marginalized as a collective. So the idea that you could or would even want to struggle as an individual to overcome the obstacles didn't always make sense. If you were Black or brown, you knew that you had to rise collectively because the system as a whole was arrayed against you collectively. But for the dominant group, which in this country has been white, right, we have had the benefit, the privilege, the luxury of viewing ourselves as individuals in ways that people of color could not. Just as rich folks maybe can view themselves as individuals in ways that poor folks know they cannot, or folks who are straight or cisgendered can think of ourselves as, you know, not having a sex or gender identity really, because we're just quote unquote normal. Whenever you're the dominant group, right, you have that ability to think of yourself in individualistic terms. Well, the problem here is that hyper individualism is also why we don't have the kind of labor protections that would give flexibility to workers and keep us safe in a moment like this. Why don't we have paid leave? Why don't we have the kinds of labor protections that exist in other countries that we like to compare ourselves to? Why don't we, going back to that healthcare piece again, why don't we have those kinds of safety nets? Well, the research again suggests that part of the reason is that unlike those countries where we like to compare ourselves, which tend to be more monocultural, tend to be more quote unquote monoracial, precisely because we are a multicultural, multiracial society, there's less willingness to provide that support to people who are in the middle or on the bottom, because there's more likelihood they won't look like you, that they won't have the same background as you, that they won't pray like you, that they'll be in some way culturally or identity-based different from you. And so that hyper-individualism, which can sometimes serve you well. Look, there are things about individualism that are great, individual rights that are great, individual freedoms that are great. But if we become so obsessed with that we lose sight of the collective good and the communal good, right, then we end up in a situation where when a pandemic comes, we're not prepared for that, because we're so used to thinking about only ourselves that what do I say? Well, you know, if those people down the block are sick, or I live in a rural or small town, those people in the big city, I mean, it's bad for them, but it's not going to affect me. Or those people across the ocean in China, they're sick. Well, it's not going to come here. It's going to be fine. I'm used to thinking of myself as this isolated, atomistic person who's not really connected to the world. And what affects you doesn't affect me. And what affects me doesn't affect you. And in fact, not only does it not affect me, I don't want to be bothered with it. Right? We have an attitude in this country. It's like, I don't want to pay taxes so you have better health care. I don't want to pay taxes so you'll have better wages. You should be taking care of yourself. Rugged individualism, pull yourself up by your bootstraps, not realizing, right, that if in fact other people become sick, if in fact other people can't support themselves, this kind of pandemic moment becomes more dangerous for me too. Right? If certain people are more likely to be affected and they're the ones who are having to stock the shelves with the food, and they're the ones who are having to deliver the stuff to my house, and they're the ones who are doing all these essential services, well, I got to go out in the world and interact with folks. So if any group of people is being affected by this, I better care about it. But hyper-individualism, which is very much connected to race and class and all these identity categories, tells me that I don't have to. So what ends up happening is we end up being at greater risk. When people have that mentality of hyper-individualism that says, I should be able to go wherever I want. I want to go to the beach. I want to go out, go to a concert. I want to go do whatever it is I want to do. I want to go shoot fireworks off at July 4th. I want to go, whatever it is. I want to go to Disney. I want to go to the park. I want to go to the mall. I want to open my business back up. All of that is understandable in the sense that nobody's enjoying this, right? I'm an introvert and it still sucks. So when an introvert tells you that they don't like having to be shut in, you can take that seriously, right? I love my alone time. I need that, right? As an introvert, it helps me recharge, but I'm done. I don't need this kind of isolation. And yet I know that as a matter of health, it's important to stay sheltered to the greatest extent possible. These folks who were demanding almost an entitlement to go where they choose. I want to go to the beach. I want to go here. I want to go there. Who's more likely to manifest that attitude in this society? Is it going to be people of color, or is it going to be white folks? Is it going to be working class folks? Is it going to be upper middle class and affluent folks? Is it going to be LGBTQ folks, or is it going to be straight and cisgendered folks? Is it going to be men, or is it going to be women? And the reason I ask that, again, ought to be obvious, right? But think about it. This idea that I can go where I want, do what I want, and how dare you tell me otherwise? And not only that, but if you try to tell me otherwise, it's tyranny, right? It's tyranny. You're literally violating my rights, my constitutional liberties, by telling me that I need to wear a mask at Trader Joe's. That's tyranny. You can literally go on YouTube and find videos of, surprise, surprise, white folks, right, who were screaming about having to wear a mask. Wow, my God, it's a violation. These are people who are not worried about children who are caged at the border. These are people who are not complaining about Ahmaud Arbery being murdered by vigilantes in Georgia. These are people who don't go to Black Lives Matter rallies, don't go to immigrant rights rallies, don't go to rallies for LGBTQ liberation. Don't do that for the most part. But by God, if you tell them that they can't go surfing, that they can't go to the beach, that they can't go to a sit-down restaurant and go to the salad bar at Ruby Tuesdays, they're ready to have a revolution, right? All of a sudden, they're done, because to them, that's tyranny. Well, that's about race too, right? That's about the ability of having a mindset that says, how dare you limit me in any way? For people of color, that ability to take for granted their mobility, their ability to go where they want, do what they want, anytime they want, is not as easy to come by. For women who have to think about that regardless of race or ethnicity, the idea of going out for a jog, for instance. Now we know what happened to Ahmaud Arbery, which is the racial end of that. But women think about being assaulted, or if they're out for a jog or a walk or a run, they can't take for granted their physical safety. Trans folk can't take for granted their physical safety anywhere, right? Working class folks know there are places where they would seem horribly out of place, so they don't go there. So once again, that's about identity too. And in this moment, we really ought to be asking what it means that some people have been able for so long to take for granted their, sort of belonging wherever they go, being able to go wherever they choose, and other people not so much being able to do that, because those are really important questions, not just today, right? But even when we get on the other side of this thing. So what are the opportunities then in this moment to meet this crisis with racial justice, a racial justice framework, and anti-racist practice? Well, first, let's start with what I think is really important to keep in mind, which is that if you look at the history of the country, any time that we actually made progress towards racial justice, it was almost always, unfortunately, not because people had had some grand moral and ethical epiphany, not because people had sort of woken up from a deep racist slumber and said, oh my God, we really should do better. Some people did that, but that wasn't the thing for most. Usually it has been because there's been what Derek Bell, the late great legal scholar, called interest convergence, right? The idea that white Americans realized in a particular moment that it was in our interest as well to move forward towards racial justice and toward building a more just community. It would have been nice if we had done that for ethical and moral reasons. And again, certain individuals would, but waiting for white America on the whole to suddenly develop that consciousness when it hasn't for hundreds of years is not a particularly good bet for safety. So Derek Bell would say, for instance, that if you look at the civil rights struggle, why was it successful in some ways? I mean, obviously there was unfinished business, but why did it succeed in the way that it did? Well, largely it was because during that period, the United States was locked in a propaganda war with the Soviet Union during a period when much of the world was coming out from under the heel of colonialism. And so you had these two models, right, that were fighting for the loyalty of the world. And it was either going to be, oh, you're going to go with this Western capitalist model, or you're going to go with this Eastern socialist or communist model. And so the United States, including its white leaders, realized They had to reform their system, our system, because how were you going to sell that system to black and brown folks all around the world coming out from under colonialism if they looked at you as all being Jim Clark in Selma, Alabama, or Bull Connor in Birmingham, right? And so it wasn't that white America had this moral awakening so much as it was, we got to do something for our own interest. Now, that may sound cynical, but it is true. And he gives other examples of it all through history as well, the struggle against enslavement and other examples. So if that's true, what would that mean right now? What would it mean to have interest convergence in this moment? And how can we craft an analysis, craft a narrative that we can begin to put forward that would take advantage of this crisis, take advantage of this otherwise awful moment to try to create something new? Well, it seems to me that number one, I've already sort of touched on, is that in this moment, we're beginning to see, I hope, and I think millions are, the brokenness of our healthcare delivery system and the need for a much better commitment to public health. The kind of piecemeal approach, not even racially and in terms of class, but just state by state, is obvious to people, maybe in ways that it wasn't before, because we can see how certain communities are being disproportionately hit, not only racially, but geographically, not only racially, but economically, not only racially, but in terms of age. So now perhaps take advantage of this moment of having that veil lifted from our eyes to some extent to ask ourselves how we got in this mess. And if in fact, as I pointed out earlier, some of the reasons we don't have a more comprehensive healthcare safety net is because we don't want those people to take advantage, let's think about how that harms us. If as a result of that fear, we don't put in place the safety net that we need, right, then all we have is our hope that we're not going to get sick. That's like all you have left, right? I mean, if you get to a point where you say, well, those people's lives don't matter as much as these people's lives or as much as my life, the only way that works for you long term, right, is if you never get sick and you never get old. Because one of the things that we're seeing right now, it's not just black and brown folks who are valued less. It's the elderly. It's people with pre-existing conditions. Well, at some point, we're all going to be elderly if we live long enough, and we're all going to have some type of health condition. So the idea that we can simply sort of, compartmentalize our experience from other people's experience, that's not just morally problematic. That's practically dangerous. It might work for you for a few years, but God forbid, you live a little longer and now all of a sudden you're thinking to yourself, maybe I shouldn't have had that eugenic mentality that said certain people were more valuable than other people. So there's a real moment for us to maybe have some interest convergence there and to talk about why it would be in our interest to move toward a much more comprehensive policy or program of healthcare and public health than what we have now. Secondly, there's an opportunity for empathy in ways that maybe we haven't always had. And that's for people on both sides of one important issue related to COVID. So I was talking earlier, right, about those who want to open back up and who are very angry at the closures and feel like maybe things are overblown. And then you've got the other folks who are very nervous about reopening things and really focus more on the public health piece. And a lot of the debate has been very acrimonious. And it's understandable when you have one side of people that are bringing their guns to rallies and they're flying Confederate flags and they're saying it's all one big conspiracy. It's very easy, I think, to look at those folks and just be like, oh my God. And for those people, I'm not really encouraging deep conversations with people that think it's all Bill Gates trying to euthanize everybody and that it's some big global Illuminati conspiracy to kill us all. I don't think we want to talk to those folks. I don't see any value in it. But there are a lot of people who are worried about the financial consequences of the shutdown who are not coming from that place, right? They're coming from a place of genuine fear, genuine concern about the ability to pay the bills. And that's understandable. How might we talk to them? Well, think about this for a minute. When you say to someone who's in that position, tell me about what you're afraid of. You ask them, right? And they tell you, I'm afraid that I'm going to lose my job. I'm afraid that in 6 months, maybe 6 weeks, I'm not going to have enough money to pay for healthcare, to pay for my kids' college, to pay for dental, to pay for the rent or the mortgage or whatever it is. Those are legitimate fears, right? And they're fears that, interestingly, millions of people had before this crisis ever hit, right? This is not new for everyone. Fear about paying the rent, fear about paying for the food in your fridge, fear about paying your utility bill, fear about whether you can afford to send your kid to college or get health care for your family. That's a fear that millions of people have on a regular day, coronavirus or no coronavirus. So perhaps it's possible for us to speak to folks who now are experiencing that, who maybe haven't experienced that before, and sit down and go, I totally hear what you're saying. And by the way, have you ever heard anyone talk about that like before now? Have you ever heard anyone talk about their fears of being laid off, their fears of being the last hired, first fired, their fears of not having adequate health care? My guess is that those folks have heard that. Well, now there's a moment, right, where we can begin to say that thing you're feeling, yeah, we need to respond to that thing. And we need to respond to that same thing when we get on the other side of this virus. And there are still people who are in that position who maybe don't look like us. Maybe they don't have what we have. Maybe they didn't have the college degree that we have. But if we know what vulnerability feels like now, let's talk about the vulnerability that others were already feeling. Second group is the group that maybe is more focused on the public health piece. Maybe they're not financially as scared, right? But they are scared about, oh gosh, can I go to the store? Gosh, can I go for a walk? Is it going to be safe? Can I go to the park? Can I be around people? Can I go for a jog? Can I go shopping? Once again, right? These are things that certain people always worry about, right? Black and brown folks on a regular day worry about, can I go to the mall and not be viewed as a shoplifter? Can I go to the Walmart and not be shot like John Crawford in Ohio a couple of years ago, right, on video? Because he pulled the air rifle off of a shelf that was being sold at Walmart, and he was just holding it down at his side. Somebody saw him, thought he was going to shoot up the store, even though he's on the phone. He's not threatening anybody. They call the cops. The police come through the doors, and they shoot him dead in like 2 seconds, and lied about it and said that he pointed the air rifle at the officer. He didn't. Tamir Rice, 12 years old in a public park playing with a toy gun, gets shot dead within a second and a half of the police approaching him. Again, Ahmaud Arbery running through a neighborhood in Georgia and gets followed by vigilantes who ultimately shoot him dead in the street. So there are people who worry about the safety of, can I go here? Can I do this all the time? Like I said before, women who worry about going out for a walk or a jog and being sexually assaulted, trans folk who worry about that wherever they might go, working class people who worry about their health care, working class folks who worry about their incomes. All of these fears that people are having right now, maybe for the first time, are fears that millions of others in this country have always. And so perhaps we can begin to talk to people in a way that says, hey, we gotta respond to your fear. We gotta take your fear seriously, but there's a reciprocity, right? It has to be a two-way street. It has to be a multi-directional street where we're all hearing each other's fears. And then the final question is this. And there's a piece I'm going to have that'll go up on medium.com, which is where my articles are posted. It'll go up tomorrow. And the question that I'm asking in that article, which I'll ask now, and it speaks to this piece of empathy, is this. Let's imagine that this virus was different. I already gave you the hypothetical before about if it was affecting white folks and healthier folks and younger folks. Put that to the side for a second. Let's just say that this virus were way worse than the one we already have. This one's bad enough, but let's just say that there was a virus right now that was so transmissible that it could travel 100 yards from a carrier when it's breathed into the air. So it's really aerosolized, it's really dangerous. And let's say that it had a mortality rate, if you caught it, of 10%, which would be off the charts dangerous, right? In that situation, which thank God we're not facing right now. But in that situation, what do you think we would do? Well, number one, nobody's going out to demand the right to go back to work, right? Everybody's going to be scared. And there's not going to be any work to do because nobody's going out and doing commerce. So there's no reason to go out. The only people going out would be the ones delivering food and supplies, and they would have to get spacesuits to probably do that to be safe, right? So most of us would just shelter in place. We might not like it, but we wouldn't argue the point. And you know what we would do? We would demand that our government meet the needs of the people during that period, right? We would demand that they not one $1,200 per adult payment, which is what we're doing now, not some extended unemployment insurance, but only through July, with the federal $600 a week edition. We would be calling for, and we would be receiving significant ongoing payments until we got to the other end of this. We would pass laws to freeze rent. We would pass laws to freeze mortgages because it would be too deadly, too dangerous. We would do that. We would do what Denmark is doing right now, which is basically nationalizing payroll. And the government of Denmark is paying every household like the equivalent of 50 grand in American dollars to get to the other side of this thing. We would do that if it was as deadly as that alternative scenario I just gave you. So ask yourself, why aren't we doing that now? We aren't doing it, A, because it's not that dangerous yet, thankfully, and it hopefully will never be anything like that, but also because of who it's affecting, right? But the fact that we could do it, the fact that we could do that, we could essentially print money and distribute it and make sure that people would be able to get food and medicine and essential services and supplies, means that it's possible. The fact that we're not doing it says we don't take it seriously enough yet. Maybe for millions of people, it's not enough risk to do that, but for millions of others, it is. So what I want to leave you with is that idea that if there's a solution other than the two we're being offered, why aren't we checking into that? And how might we encourage people to demand more of our collective? That is to say, the government that supposedly represents us. Because right now, the choice we're being given is our money or our life, right? Your money or your life, as if that's the only two options. And the media culture, the political culture is making it seem like that. So you got folks on the right that sound as if they're very greedy and saying, oh, money, we got to go back to work. And then you got many people on the left that are like, but people are dying. But this is a false choice that we're being given, right? It's a false choice because we are so committed to keeping safety nets minimal and not having government help us when we're in need, that we would be willing to let people die just to not have that mentality challenge. That's not saying this life is worth more than this life. That's saying that some lives are not even worth as much as your ideology, right? That some lives are not even as important as your politic. That's a really sad idea, right? But it's true, because if we would do all of that stuff in an alternative scenario, why aren't we doing it now? And what does that say? And we're all at risk, because if we're all going to get older and we're all going to get sick at some point, this pandemic may not affect the majority of Americans, but if we have another one in 20 years, the folks that are 30 right now that are like, I want to go to the gym, I want to go to the beach, well, they're going to be 50 or they're going to be 60. And then they're going to be on the bad side of, on the business end of the gun, as the saying goes. So maybe we have this opportunity, right, to build some empathy and to challenge folks to think more broadly about what we could be doing in this moment to support people, not just individually, but collectively. And I think if we ask those kind of questions, we can maybe create a different social and political reality. So I would leave you with this, and I would encourage everyone to do this when you get a chance. Make a list of the things that you perhaps used to take for granted before COVID-19, but which you can't take for granted now, if there are any such things. And then make a list of the stuff that you're still able to take for granted to some extent, but which maybe others can't. And I think both of those lists, you're going to find that it reflects something about race and class realities in America, right? I can give you two examples of mine, right? The notion of being, are we safe in stores and public spaces? When I go out, went out today to, it's Mother's Day. Happy Mother's Day, by the way, to anyone who's a mother on the call. Went out with one of my daughters to get some donuts for my wife, and masked up, went to the place, the mask, and when I go out in public, I wear the mask pretty much all the time, but almost no one else over there was, right? They didn't seem to be too concerned, but I was. And it's because I'm really thinking about that, right? I'm worried about, is it going to be safe? But that's not something that I would normally really think about when I go to the store. I know I'm not going to be thought of as a shoplifter. I'm not going to be thought of as a criminal. So I can put the mask on and take for granted, for instance, that I'm not going to be viewed as a gang member. A lot of men of color have talked about not wanting to mask because they're afraid of being marked in that way. So it's an example, right, of when you think about your own experience, how different it can be. And then secondly, though, there's something I'm also able to continue to take for granted, and that's a certain degree of financial security. Now, I've lost 85% of my income. My wife has lost 100% of hers. But I have housing equity, which if I have to tap into it, I can. That is a form of economic privilege and a cushion, a safety net, right? And I'm just lucky to have it because there's some people in the neighborhood that moved in about a month and a half ago. They probably haven't had time to accumulate equity yet. They just bought their house, right? Took us several years to accumulate what we have. So some of it's luck. It's not about financial planning. It's not about, oh, I'm really good with investments. I couldn't pay the bills. If something happens to my wife, my family's done because she does all the bills and is the only one that knows how to do it. And I would be completely screwed, right? But it's because we're in a position to access certain things. I can continue to take that for granted. But how many millions of people can? I think if you make these two lists, what are the things you used to take for granted that you can't now? What are the things that you still take for granted that others can't? You begin to see how this moment merely elucidates and illuminates these inequities that have been with us the whole time, right? It's not that they're new. It's that a light is being shown upon the disparities that already were there. And hopefully we can use that kind of discussion and use this moment to ask these really deep questions to people who maybe up to this point haven't wanted to be a part of that conversation. So with that, I'll end pretty much right at the hour of presentation since we started a few minutes late. So I feel reasonably good about my time allotment. Hope that wasn't too much. Sorry, I didn't have any visuals or cool slides or anything. Last time I tried that, I screwed it up terribly. So anyway, thank you all very much for hanging out and listening to me do my thing for the last hour. And if you have questions, you can submit those to the moderator, and we'll go from there. Thank you all so much.
Thank you, Tim. We have a question from Deb. Given that demanding that the government see the needs of the people is limited because of our inability to gather and protest, what are your recommendations for leaning heavily on government officials at this time? Yeah. Folks during the AIDS crisis could do die-ins in the street and gather at the CDC, and I feel limited by inaction, by an inability to move and protest collectively.
I think it does make it much, much harder. And I know there have been some demonstrations, including some really spirited ones, rent strike demonstrations in various places. Of course, you have Amazon workers and others who have been doing some good strike actions, but it's hard because unless you're already out there, as is the case with some of the Amazon workers and other warehouse workers, they're already on the job. So for them, it's really not any riskier to do that than it would have been to go to work in the first place. I would say, number one, a lot of the activity is going to have to be among those people who were already out there. It's going to have to be people who are already in a position where, frankly, they're already at risk and they now need to make their voices heard. So some of those strikes that we've seen have been really great. And I think that kind of mass action is going to be needed as we move forward. Secondly, I think even if it involves putting on significant amounts of PPE and masking and doing that kind of thing and social distancing, we can still demonstrate. I saw there was this amazing aerial, and I don't even know the story behind it. I didn't have time to read the article, but there was an aerial photo that was taken of protesters, who were in I guess it was either Tel Aviv or Jerusalem, but it was in Israel, and they were all spaced out by like 6 feet, right? Everybody was 6 feet from everybody else. And I don't even know what it was that I guess they were demonstrating over the sort of inability to find a functioning government that can lead in Israel right now, but they were all spaced out, but it was very powerful. There was actually something quite powerful about this demonstration of however many thousands of people it was, even with that distance, because it actually spreads out the space even more, and it sort of creates this very powerful aesthetic. And I think we might be able to think of these different ways to do demonstrations. Sometimes we think of demonstrations and mass tactics, and we think about the same models that we're used to. We think of it as people jam very close together with signs, chanting, and we're sort of close to each other. And clearly right now, that's going to be quite dangerous. But there are other models. And I think that maybe thinking about that would be one way to go. I also think that we're going to have to figure out ways to organize probably rent strikes and, I don't know if there's a mortgage equivalent of that, but I guess we'll find out pretty soon, because the idea of people not paying their bills but doing that collectively is going to be important. Obviously, if individuals say, well, I'm not going to pay my bills, well, as an individual, you don't have a lot of power. with that move. But if groups of people, if entire neighborhoods, if groups of people decide collectively that they are going to say, we're not, if entire apartment complexes, for instance, and condominium complexes say, we're not going to pay the rent this month, or we're not going to pay the utilities this month, then all of a sudden, even if it's at one particular location, that's a more powerful message. It's going to be much harder to even think of evicting 50 people in an apartment complex as opposed to one. But there has to be some collective, sort of mobilizing there. It's going to be difficult for a minute. I think a lot of what we do has to be planning and preparation, knowing that when we get on the other side, and maybe that's not even the right imagery to use, not on the other side, but when we get further along in this process, because the other side, we don't know when that's going to be. When we get further along, I think if we have planned and prepared for the mass mobilizations, then that will also be helpful. It'd be nice to be able to do it like right now or yesterday, but at the very least, let's figure out what do we want to do when it becomes safe enough to really get out and do whatever that is, because we don't want to wait until that moment and then start planning. That's the thing I fear, is that we'll wait and then all of a sudden we can get together. So, what should we do now? Well, we need to be thinking about what we should do before we have the opportunity to do it.
Okay, here's another question. What do you think about Governor Newsom's announcement that in California, COVID began in a nail salon, but did not elucidate further? Does it compound the idea that Asians are to blame for this virus?
Yeah, I think first off, all I know about that, it seems a little premature first to make that statement. I don't know that the etymology, the epidemiology actually suggests that can even be demonstrated. I do know that in New York, what we know is apparently that the first cases in New York certainly came from Europe, probably from Italy. There are going to be different places in the country where the respective patient zeros, if you will, are going to have been from all kinds of different places. And some of those patient zeros in certain states are going to have been from other states, and who knows where they, ultimately contracted. But I do think there's a real danger in saying anything that could reinforce this notion that it's racial and cultural and ethnic others, whether it's, folks in a nail salon who are Asian or Asian American, whether it's people in Chinatown in New York who were being blamed and looked at very suspiciously in the early days of the pandemic, or even whether it's international travelers. The reality is, like I said, unless we are prepared to blame North Carolina hog farmers for H1N1 in 2009, which we didn't do, nor should we have done, right? It's not their fault. Viruses can emerge anywhere. As a species, we are encroaching on the habitat of so many other species that there are literally millions, if not billions, of viruses that we haven't even come in contact with, but we will if we continue to encroach on the habitats of other species. We will if the ice caps continue to melt and release viruses that have literally been frozen for however many hundreds of millions or billions of years. So this is going to happen more and more often, and these things could emerge anywhere. The reason that they're more likely, just on a purely demographic level, the reason they're more likely to emerge in China is because China has a disproportionate share of the world's population. So if you have like 18%, I think it is, of the world's population is in China, as opposed to like Wyoming, right? Which of those is more likely to have the virus emerge? It's China, because there's more people in China, because there's more opportunity in China, as opposed to thinking that it's something cultural. And so I think we just need to be careful, and our leaders need to not speculate, because wherever it begins doesn't really matter, except insofar as we have a public health infrastructure in place that can respond to that wherever it is. I'm not sure what we gain scientifically by knowing that it's a nail salon versus a wet market versus a hog farm. Like, what it says is that we probably need to have a better health infrastructure in place for all of those potentialities. And it's not as if, developing a better infrastructure that would meet the hog farm condition would somehow fail with the nail salon condition. Like, wherever it emerges, if you're ready, you're ready, right? That's the bigger issue. And I think that's what the governor and others miss if they are so focused on, well, who's to blame, right? No one's to blame for viruses, but how we respond to the virus is what we have some control over.
Great. Okay, here's a comment from someone who says 80% of white working class voters, no college degree, would vote Democrat, support Black Lives Matter. How do you explain this?
80% would?
Um, it's not very clear by the question.
I would love if it were true that 80% of white working class folks would support Black Lives Matter. And I guess voting Democrat by comparison to the alternative too. I'm not sure that it's accurate. I guess it depends on how we define working class. Obviously, you know, if you look at, take elections, for instance, first, if you look at electoral politics, it's certainly true that really lower income whites, truly lower income whites, do tend to have economically much more progressive views, frankly, and do tend to vote Democrat in most elections. So the idea that low income white folks vote for Republicans, that's not really accurate so much. Even the ones who don't have college degrees tend to vote for Democrats. Really, the biggest problem group is not really what we would consider the hardcore working class. It's really like this anxious middle, right? It's this group of people who were the disproportionate Tea Party folks, for instance, and the disproportionate Trump rally folks. You know, that research has been done, and those are not like really hard scrabble working class folks most of the time. Some are, but it's not like coal miners and steel workers or whatever. It's not. It's disproportionately people whose median income is around 70,000. They work in the service economy. You know, they have middle management type jobs. They're people who are well enough off to not have to usually go and do backbreaking labor in order to make their money. They have enough class status, socioeconomic status, to not have to do really backbreaking physical labor, but they don't have enough to be considered affluent or to consider themselves comfortable. And so that's that group that feels like, you know, I'm not quite up here, but I'm better than these people. And there's this psychology to that group, right? There's a psychology that has existed in this country for a long time for those folks that are just a little bit above the really struggling people, but not far enough up here to take much for granted. And they tend to look down on these people down below them because as a country, we have created these, what W.E.B. Du Bois called the psychological wage of whiteness, right? Telling white people who really don't have that much, they're not the poorest of the poor, but telling those that are sort of right about here, hey, at least you're better than these people, right? So don't look up at us. Don't blame us for not having more. Blame them for taking your tax money. Blame them for whatever insecurities you have. And so part of getting white working and middle class people to be more politically committed to progressive politics, according to the research, is dealing with that racial manipulation. And it's not just race, though. You know, I would say that whereas Du Bois talked about the psychological wage of whiteness, well, we've also created a psychological wage of Christianity, a psychological wage of, by God, I'm an American and I speak English, right? Or a psychological wage of heterosexuality, or a psychological wage of masculinity. So what we say is to men who are straight in particular and cisgendered, you know, you might not make enough money. You might not be doing as well as you'd like on the job, but at least you're a man, and at least you're straight, and at least you speak English, and at least you're important in your church family or whatever, right? We've taken these other identities and we've built them up in a way that allows working class and middle class people to not think in terms of class, right? To actually think of their identity in terms that are not economic. And this is a real conundrum for progressive people, right? This is a real catch-22 for us, because those of us who come out of a left tradition think that we want to speak to people on the basis of their rational economic interests, and then we get all confused when they vote against them. Right? We can't quite figure it out. We're like, why do these people keep voting against their interests? They're not rich. Why do they vote for candidates that cut taxes on the wealthiest people? Right? And we think, God, are they stupid? Do they have, you know, Marx would say false consciousness? Like, what is it? But what we're missing is they're not stupid. They're simply defining their interest in terms other than economic. They're saying, well, maybe I am getting my ass kicked at work, but at least I'm white, and at least I speak English, and at least I'm straight, and at least I'm Christian. Unless we deal with those things and how they have been given status as property, like actual property that I can use to get over on somebody else, unless we address that, we're going to have a very hard time building class solidarity. Because in order to get to class solidarity, you have to fight white supremacy and patriarchy and straight supremacy and ableism and all these other things.
So there's a lot of questions about recovering from all of this racial animus. And so one question is, what do you think it will take for us to recover from all this racial animus that is bubbling up around the country? And then another question from another questioner that seems somewhat related. What has created the huge backlash against diversity? And the person has heard the expression diversity fatigue.
I think the backlash is less to diversity and more to pluralism or any movement toward greater equity. So if you think about it, this country's always been diverse. It was diverse it was diverse even before white folks got here, people from Europe, because there were hundreds of indigenous nations that were very different from one another. Certainly when Europeans came, we added some additional diversity to it, and African people did, and all people did. So we were always diverse, and that wasn't the problem, right? The problem was whenever that diversity moved towards upsetting the apple cart of existing hierarchy and domination. So it's, I come from the South, and in the South, white and black folks were always around one another. It wasn't like it is in some places where you had a very clearly identifiable part of town that was white and another that was black. Sometimes you did, but I lived in New Orleans for 10 years. And the thing about New Orleans, with the exception of a few neighborhoods, you had white folks and black folks who lived within very close proximity, but the status they had, right, the power they had, the quality of the infrastructure in their home and their surrounding streets and everything was clearly very different. So it wasn't the diversity itself. It was, what's the power arrangement? And I think what we've seen, Carol Anderson talks about this in her book, White Rage, she's a professor of African-American studies at Emory in Atlanta. Whenever we have moved towards greater equity, every move has been met with that kind of backlash, or what she calls white rage. And she goes through them, the post-emancipation backlash that brought us Jim Crow segregation and mass lynching, the backlash to the civil rights movement that brought us the sort of closing of schools in the South rather than integrate them, the backlash that brought the second wave of Klan activity in the 1960s, the backlash to affirmative action, which followed that. Then you had the election of Barack Obama, which again was sort of not nearly as significant an event in terms of racial equity as some might have thought it was going to be. But boy, to some people, it was way too much, right? To some people, just the idea of a person of color in charge of the country was just like, no, no, no. And then you had the backlash of the Tea Party and birtherism. And in some ways, Trumpism, right, is a form of white rage reaction to that. So at every step that has happened. So at least number one, we know that, and we can't be surprised or thrown off by it because it has been a pattern that has existed for hundreds of years. How do we move through that is, however, a big question. And I wish that I had the answer. I do think, going back to what I said about Derek Bell, Bell's theory of interest convergence, it was very hard. First time I heard it, and I knew Professor Bell pretty well before he passed, and was honored enough to have some conversations with him. And I always remember being challenged by his analysis because some people took it as very pessimistic. The idea that you had to have interest convergence, and as a black man saying that, he would get flack from black folks who thought that he was not solicitous enough of the civil rights tradition, because it's almost like saying, well, are you taking credit away from the genius of the movement? And he, of course, would say, no, I'm not. I'm just saying the genius alone wasn't enough. You had to have this set of circumstances that made that workable, because there were always genius black people fighting for freedom. There were always genius black folks who were fighting for freedom and didn't always achieve what the civil rights movement achieved. So what's the difference? Was Dr. King that much smarter? Were the people in SNCC that much smarter? Or was there some stuff happening? It wasn't taking away from the greatness. It was simply recognizing there are moments you have to take advantage of. The genius of the civil rights movement was they knew that, right? So Dr. King, those folks knew that we were in the middle of that propaganda war. And so what did they do? They cast the civil rights struggle as a fight for the soul of redeeming the soul of America. Right? They made it very much about how, hey, we say we're this thing, but really we're this thing. Now, you could take a much more radical position that says America was never hypocritical. America was always a racially fascist place. And probably the civil rights activists deep down would have said, yeah, that's true. But their public position was not, we've always been this racially fascist place that we have to just simply go burn down or overthrow. Their argument was, we have lied. We've been telling a fib all of this time, saying one thing, doing another. And that took advantage of that moment, right? That allowed people to look at it and go, oh, okay, so we're not living up to our promise. That was a smart strategy in that moment. It allowed interest convergence. It allowed just enough white folks to get behind the movement to allow those laws to change and things to slowly reform. Not nearly enough, but to make some positive strides. I think moving forward, we have to find those opportunities for interest convergence again. And they're not always obvious, but I think some of them are pointed to by this crisis, as I discussed in the speech. And so I just want us, whenever we're thinking about it, it'd be nice if we could just make the moral argument, the ethical argument, the spiritual argument, and everybody agree. But the reality is, I think people of color know that if they're waiting around for white folks to have that spiritual epiphany, they're going to be waiting a long time and far too long. And so sometimes you have to think in, what are the ways right now that we can get as much movement as possible? And that is by showing the cost, the real damage that is done to white folks when you maintain white supremacy. And I've written about that elsewhere. I think we can say, for instance, that the opioid crisis disproportionately in white America is partly the result of a society that for years, forever, told white people, particularly white working class men, that as long as they worked hard and played by the rules, everything would be fine. And then when the economy globalized and a lot of those jobs disappeared and they didn't have the opportunities that they had previously, even though they were still better off than people of color, they were worse off relative to what we promised them. And how do you deal with the pain and the frustration of being told that your life was going to be a 7 or better, but actually it's only a 4 or 5? If you're a person of color, you knew you were going to have to grind to get to that 7 or 8. But if you were a white man, you were told this world was your oyster. All you had to do was play by the rules. And then when people found out that wasn't true, they're now anesthetizing their pain. That's interest convergence too. There are lots of these moments, and I think we want to think of it in those terms.
There's also a lot of questions here about, I don't know, how much time do we have left?
I don't know.
How much longer can we go?
We have 5 minutes, I believe.
Okay.
Okay. How about one more question, and then we'll wrap it up.
Sure.
Let's see. So there's some concerns about the economic impact of the shutdown, and one person asked, speaking as a commercial real estate landlord, how are we supposed to pay our taxes, insurance, and other expenses if our tenants don't pay the rent?
Yeah. I mean, I think these are all great questions. And I think this is one of those reasons why you can't just have a policy that tries to offer relief to one segment of the community. It has to offer relief to everyone. A lot of times, when this all hit, there was a lot of discussion about, well, do we want to target certain benefits just like means tested just to the poorest individuals, right? The ones that are in the most need. And on the one hand, you can understand the logic of that. But the problem, right, is that if you only do that, then you're going to have a lot of people who are middle class, who are not necessarily the most in need, but they can't pay their rent. And then it starts to cascade. And then the landlords or those who are property managers or the banks that hold mortgages, then all of a sudden you start to see a domino effect. So we really have to be thinking in broader terms. What are we going to do to sustain all of these folks through the freeze? And what's happening in Denmark, what's happening in other countries, what happened in Italy, one of the first things Italy did was they said, we're going to freeze mortgage payments. We're going to take those mortgages, whether it's commercial real estate owners or residential owners, and we're going to tack the 6 months or the 3 months or whatever it takes. We're going to tack it on the back of the loan. We're not just going to say, oh, in 6 months, it's all due now. That's not helping anybody because you weren't working for 6 months or you weren't working for 4 months. You didn't have any income. We're going to take that. We're going to essentially send for loan forbearance, put it on the back of the loan. So if it's a 30-year loan, now it's 30 years and 6 months. If you got 15 left on it, it's 15 and 6 months. If it's rent, same thing. If I freeze the rent, but I don't freeze the payment that the owner of the property has to make, I'm obviously not helping, right? Because they still got to make a payment. You got to freeze both sides of that. And so I hope, again, here's a moment where a rare moment when a tenant and a landlord has a commonality of interest. A lot of times we don't, let's be honest, right? A lot of times tenants and landlords very different interests other than just making sure the property's up to code and decent and safe and healthy. But here's a moment where the tenant and the landlord both have an interest in slowing this thing down and freezing certain elements of the economy and making sure that the payments on both ends can be given forbearance. You can't just do it on one end or the other. You have to do it on both. And right now, we're just not talking about it that way. Italy is, Denmark is, other countries are, and we're not.
I actually have one more question, and then we'll wrap
Okay.
it up. I was thinking as a practitioner a lot about the 5 remembrances, and sort of in the conclusion of discussing the 5 remembrances is our actions are the ground upon which our life stands. And so guess the final question is, as allies and people who are committed to anti-racist activism, what can we do?
Well, I think we want to take stock of, in this moment, where we are in this greater sort of discussion about identity and where we sit in terms of our privilege and our access. Asking those questions that I asked everyone to ask, take some real time to do that. Take this time also where maybe we have more time than normal to do some research, to listen to the voices of people that you don't normally listen to read the books and writings of people that maybe you don't normally read, to discuss these things with your kids if you have kids in the house, to take this opportunity to learn. You know, normally when we're out doing our thing in the world, we don't always have the opportunity to slow down and to take that opportunity to feed our minds a little bit and to really sit and just think. And so if what this moment gives us is the opportunity to engage in some deeper reflection and some real honest, deep thought about where we sit in this society and where we want to go moving forward so that we're ready for, you know, these kinds of eventualities and can move through them more effectively in the future, then let's take that opportunity rather than squandering it. You know, we're all afraid, we're anxious, we don't know when this is going to end. Let's figure out how we can make the steps that we need to not be so afraid if it happens to us again at some point in the future.
I'm putting that in the chat box for people's information. And also the link for donations is also available. Martin, you want to say anything?
Yeah, I just wanted to thank you so much, Tim, for taking the time and really
Absolutely
learned so much today and appreciate it. As I mentioned, we are accepting donations. Your donations go towards supporting Tim Wise and also Inside LA. So please consider making a donation. I know that right now, especially for educators and public speakers like Tim, as you mentioned too, that your income is greatly impacted by the pandemic and safer at home. So please consider making a donation if you have the resources to support. Okay.
That's great.
Thank you, everyone.
Thank you all so much.
We can send this recording to the people who attended if you would like to hear it again.
Great. Thank you.
Great. Thank you, Tim.
Thanks.
Bye,
Blessings,
everybody.
everyone.
Take care, everyone.
Thank you for your practice.